sir, and my supervisor. And this is my final year project progress presentation. So the topic is an investigation into a smart healthcare monitoring system in an IoT environment. So moving forward, these are my contents where I have gave a brief description about the objectives, problem statements, scope of study, literature review, prices of the hardware components, progress, flowchart, system architecture, and Gantt chart. So moving forward, these are my objectives where I have given these objectives to implement an IoT-based patient monitoring device that monitors the heart sound, pulse rate, and blood pressure to measure the patient's heart sound, pulse rate, and blood pressure using Raspberry Pi to minimize the cost of the developed system to fulfill the requirements of the patient at home by the doctor, to store recording or to store the reading of patient's health in the cloud database. And moving forward, these are the problem statements. So when a patient visits a doctor, there is always a long waiting line, even in the emergency room, to get checked. The developing technology has enhanced the way of the patient being treated. Most of the patient might be in a severe heart condition due to the amount of increasing pollution, eating habits. Each and every seconds are important for the heart patients. When the patient's blood pressure and the pulse rate are monitored, there might be error due to accuracy. So to overcome this error, the measurement must be taken thrice. So moving forward, these are my scope of study where health monitoring takes place in a variety of settings, including hospitals where nurses and physicians monitor patients, or where an individual is injured or exposed to dangerous chemicals. The IoT, Internet of Things, is a rapidly growing subject with significant social, economic, and technological implications. It is designed with a suitable protocol that allows the interacting and communicating with each other and with the users respectively. IoT uses sensors, processors, and microcontrollers with accessories used for communication across the internet and being a constitutive part of the internet. So this is my literature review where I have given like 5 literature reviews where all given brief description about the author, title of the paper, variable design, equipments, important findings, limitation of study, research gap, and application area, where application area is all healthcare. So, and the equipments used in all are, most of it are Raspberry Pi. And these are the brief descriptions of the important findings and limitations of the study. So, similarly, Raspberry Pi and Raspberry Pi. So these are the hardware components where I have the hardware components are Raspberry Pi pulse rate sensor, blood pressure sensor, LCD display, temperature sensor, and ECG sensors, and cables. And I've given the quantity and prices for each. So moving forward, these are my progress. So the current progress is I'm done with all the references and adding more references for more idea, working on the review paper and summarization of the literature review. So these are the current progress, and pending progresses are completion of the review paper, searching for more relevant research paper for references, citation from Zotero in IEE format. So this is my flowchart where there is start, sensor initialization, then checks the patient's health parameters. So checks the blood pressure, heart sound, pulse rate. So this is displayed on the monitor and sent to the server. Then the doctor accesses to the sensor through the IP address. And if the blood pressure is greater than 120, alert email is sent to the patient as well as the doctor. There is a notification sent to the patient as well as doctor, and patient and caretaker access to the server through the IP address itself. So it is very interlinked, and our doctor plays an important role in receiving the alert email, whereas patient also plays an important role in receiving the notification. So this is my flow chart. And then moving forward, this is the system architecture where patient and doctor both play an important role. So first there is temperature sensor, heartbeat sensor, and ECG sensor. The sensor value goes through the Raspberry Pi, and then the sensor reading is displayed in the LCD display. Then the data is transferred to the server and stored in a database. Then if there is any error in the reading, if the temperature is greater than the required temperature, and if the heartbeat sensor has heart palpitation, if there is heart palpitation, and ECG sensor if there is error in the reading, or if the reading is very high than the given amount, then SMS and alert email is sent to the doctor in case of emergency, and the doctor can go through the server and see the data from the database itself. And then after the doctor receives an email alert, then the precaution notification is sent to the patient, and the patient also receives the notification to take medicine, or to come to the hospital to check with the doctor, or like do something. So the patient's time is saved, and then the care is taken at the time which is required, and it saves so much time, and even the doctor's time as well as the patient's time. So all these data are kept in the server, in both the servers, in the database where it's stored safely. And this is the basic system architecture of my project. So moving forward, this is the Gantt chart where we have done literature review, research proposal presentation, research proposal submission, research on the existing systems and required components, progress presentation, FYP 1 presentation, final version report submission, and these are the activities. So activities are implementation and development, system testing, submission of progress report and presentation, modification, testing, documentation, final presentation, and final report submission. So this is the Gantt chart. In April we did the literature review and research proposal presentation. Then in May we are doing research proposal report submission, research on the existing systems and required components. Then in June and July, progress presentation. Then in July we have July and August, which is left and in progress. So for October, November, December, and January and February, we have to through all these implementations and testing and documentation and modification and submission of the progress report. Then we have final presentation and final report submission. So moving forward to my contents, I have covered objectives, problem statements, scope of study, literature review, prices of the hardware components, progress, flowchart, system architecture, and Gantt chart. So going back to the literature review, here in the important findings, we have discussed about IoT to collect and analyze data in real time. Then we have discussed about healthcare system, the combination of Raspberry Pi and IoT. And then we have discussed about ECG signals, then based on correct localization transmitted data. Then we have discussed about cloud server, Bluetooth, ECG sensors, Android phone, then innovative method which uses ECG surveillance, translation, and warning management systems. Then we have patient monitoring and control using feedback and GSM remotely track the various parameters of an ICU patient. Then we have ECG modules. So these are the overall things we have discussed, and likewise comes to an end to my progress presentation. So thank you so much, sir, and thank you so much, supervisor. Thank you so much.